Hi you guys, today we're going to demonstrate how to do wall angels. A lot of our patients come to the office and I always talk to you guys about doing wall angels to strengthen the posterior neck muscles. We're going to talk about how to do traction sitting up in a chair and how to also do traction laying on the back of your bed. So with wall angels, what you want to do is make sure that your back and your backside are touching the wall the entire time with your head as well. However, you want to position your head about a 45-degree upward angle, and then what you want to do as you're doing your wall angels, your arms should be flat up against the wall, and they're coming up the entire time behind your head and coming back down. The entire time you want to make sure both, right now my arms aren't doing it, but both your arms and hands are touching the wall and that your hands are meeting behind your neck. When you do this, what you'll notice is the posterior neck muscles and the muscle behind your back and your shoulders will start to get really tight. The one thing you don't want to do is you don't want to come up here and do them in front of your head because you won't notice anything. You won't feel anything and it won't make any change. Our job is to help you strengthen the back neck muscles so that you can hold the adjustments and your body will become more stable and strong. Okay? Now what I'm going to do is go ahead and demonstrate how to do traction sitting in the chair. We always talk about doing those neck exercises. First, I want you to find a chair that has a high back. Sit up nice and tall, as I am now, and then look straight ahead. This is the reason I'm doing it from the side. And I want you to lay your head back. And you'll do this for anywhere to start with 30 seconds up to 2 minutes, and eventually you'll work your way up to about an average of 20 minutes. Now, when you do this, you can initially get a little bit dizzy or lightheaded. If that happens to you, just go ahead and continue to let your head rest through it. However, if you continue with nauseousness, a headache, intense pain, migraines, anything abnormal, I want you to stop immediately and come back in and tell me about it, okay? Now the last thing I want to demonstrate for you guys today is how to do the neck traction on the back of the bed. So what you can do is, let's just say this was the mattress inside my home, you can lay your head on the edge of the mattress. You'll scoot down slowly till your head completely falls off. And you keep your knees bent to reduce the amount of tension on your back. And as I lay here, there's probably blood rushing to my head. However, the goal of this is to stretch out the front neck muscles and cause the posterior neck muscles to shrink back up, which allows the body to get the curve back in its neck. Now from here, you don't want to just sit directly up because you'll get extremely dizzy and lightheaded and you might even pass out. So after you've done it for anywhere from 2 to 5 minutes, eventually getting up to 20, you'll scoot down, make sure your head is now supported by the bed, and wait a few minutes. And when those few minutes have passed and you feel like the muscles are nice and relaxed, you'll turn to your side and you'll push yourself up. And you'll do that from, like I said, you'll start from 30 seconds up to 2 minutes every day. And as you feel you're able to, you'll increase time to increase the amount of tension on your spine. And our ultimate goal, again, is to get to 20 minutes, okay? If you guys have any questions, feel free to call me at any time or call the front desk. They'll always be able to answer your questions. Till next time.